I'm going to tell you a story. In September of 1928, a slightly careless scientist returned from a restful 2-week vacation to find two things growing on what should have been a sterile bacterial culture plate. The first was the bacteria Staphylococcus, and the second was fuzzy white mold. When he looked more closely, he realized that mold was inhibiting growth of the bacteria, and in so doing, accidentally discovered the world's first antibiotic. That scientist was Sir Alexander Fleming, and the mold was producing something I think you've heard of before, which was penicillin. This sparked a revolution in modern medicine, and over the following decades, dozens of antibiotics were discovered. But less than 100 years later, they say we are already entering the post-antibiotic era. Now, bacteria have developed ways to avoid being killed by antibiotics, something called antibiotic resistance. So these life-saving drugs may no longer work as well for the infections they once did. Each year, 700,000 people die from antibiotic-resistant infections. Human hospitals have tackled this crisis through developing antibiotic stewardship programs. Antibiotic stewardship is the concept of using antibiotics responsibly and only when needed. And programs accomplish their goals by distributing guidelines for best use, having pharmacists provide advice, and tracking prescriptions of important drugs. This sort of thing is right up my alley. I grew up in a medical home. My father was a doctor and my mother was a pharmacist. But Dad always said if he could do it again, he would have become a veterinarian. I listened to his advice and went to vet school, and probably because of my mother's influence, became a veterinary pharmacologist. I was so excited when I came to Tufts 5 years ago and learned there was a One Health team already in place starting to work on antibiotic use in dogs and cats. One Health is the concept that our world is shared by plants, humans, and animals, and strategies successful in one field can inform approaches in others. Our One Health team consists of veterinarians from the Cummings School and doctors and a pharmacist from Tufts Medical Center. And together, our goal is to bring successful strategies from human medicine to companion animal practice. This approach is actually pretty unique. To date, most of the work in veterinary stewardship has focused on farm animals because that's where the majority of antibiotic prescriptions occur. But farm animals don't live in your homes, your pets do. There's increasing recognition that antibiotic use in any member of the home changes the bacteria found in the humans and animals living there. And research, including some of my own studies, has identified the direct transmission of antibiotic-resistant organisms between pets and their owners. Despite this, judicious antibiotic use has only recently gained attention as a need and a priority in companion animal medicine. I'm proud to tell you, though, that Tufts has launched a small animal antibiotic stewardship program. I'd like to share with you more about one of our efforts. One of the biggest challenges in veterinary stewardship is that right now, we don't even know how many antibiotics are being used in dogs and cats. We can come up with many strategies to improve prescribing, but if we can't measure their impact, it's really difficult to design an effective program. This problem is compounded by the fact that some veterinarians use paper records and others use a variety of electronic medical record systems. To address this, we have developed a tool that extracts antibiotic prescription information from electronic medical record systems. To use an analogy, if your hospital spoke French and my hospital spoke German, this tool would translate us both to English so we can directly compare medical records information. Using this tool, we've already extracted antibiotic prescription data from patients at the Foster Hospital and are working to evaluate areas with frequent antibiotic use to determine if those prescriptions are appropriate. We're working on expanding this tool to other universities and will then branch out into a network of private practices. Our goal is to be able to automatically capture medical records information so that we can report back to veterinarians how their antibiotic use compares to other vets in similar situations. Though I love this program and what I'm working on, I didn't actually come to Tufts to be a researcher. I came to be a teacher. I'm most excited about this work because I'm teaching veterinarians and veterinary students about the need to use antibiotics wisely for humans and animals. I know that with each person we reach, they will help spread a message that will preserve the utility of these life-saving drugs for generations. Thank you.